got diagnosed, I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time ang PCOS, hindi pa siya basically well explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro I started having hypoglycemia afternoon. Tapos yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kong aparador, mukha na daw kong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Through Ma'am Jansen and Mr. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusin, Mom, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw. Sabi nung, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you know, the result actually says ovarian is bilateral. So, both sides. Yes,
bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tap ko, reduce na yung size. So, working on it para ma-clear na siya. First of all, Shyan and Ma'am Jocelyn, really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila. Medyo nire-refer ko na rin sila. Tapos, kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did to you, it wouldn't be hard anymore because they see the improvement. They see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Even before pregnancy, I'm already taking PPARs. My husband and we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think during this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. I really think that contributed for us to have a healthy pregnancy. And yeah, that's what I also took after I have given birth, because I had emergency CS. So, but on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPAR, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also, and I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body, and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that would also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2 breast cancer. I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, falls apart, So down. There is no symptoms. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was on the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Ano po, sabi niya, makakatulong ang mga chemo patient, yung simply nature PPAR. So, if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised chemo with PPAR powder, saka tablet. So, at first, I was hesitant kasi very mahal po siya. Pero, first chemo ko, taking PPARs, hindi po ako nahirapan. So, I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So, I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the kasi po even my co-teachers, even my family, sabi po sa akin hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So, I just ordered 6. 6 ngayong May. So, that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification. So, I thank God for that. Ang papayo ko po sa mga pasyente po na go to the right doctor, no? You pray for the right doctor lang para bigyan kayo ng the right supplements and para yung journey nyo will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko, most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me. Na-take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful. Kasi may supplement ako galing sa Simple Nature, which is PPAR powder and PPAR. So, together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nung sabi ko, attend kami, was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a pupper. I was diagnosed with stage breast cancer. Upon knowing my situation, it was really a big event. I was advised to do 8 cycles of chemotherapy and nakakot ako dun sa chemotherapy. But with the help of Simple Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simple Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simple Nature. I trust Simple Nature.
And we are live! Healthy day, everyone! My name is Jansen and Mr, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. Welcome to the last episode of the first month of this new year, 2026. Last week, we talked about survival, but moving on tonight, we'll talk about stability. So I want to acknowledge something that often goes unspoken for many patients, which is finishing treatment doesn't end the fear. In fact, for some, the fear gets quieter but heavier because the question now becomes, what if it comes back? And the second time, it's stronger. Tonight's session is not about feeding that fear, it's about understanding what actually reduces the conditions that allow recurrence to take root and how the body can be guided gently and consistently toward repair. This session is entitled Reducing Conditions for Recurrence by Supporting a Repair Dominant Internal Environment. And that phrase, internal environment, is the key. Tonight, we'll talk about three major internal conditions that quietly increase recurrence risk over time. So, one is chronic inflammation, second, metabolic imbalance, and third, immune exhaustion. These don't usually cause loud symptoms, but it's why repair gets delayed. Let's start with chronic inflammation. Inflammation is not always bad. It's part of healing. When inflammatory signals stay high, cells behave as if danger is ongoing. Even when treatment has ended, it's like the body is always on alert instead of repairing tissues or restoring balance or clearing damaged cells. Now, next is metabolic imbalance. When cells struggle to regulate energy, whether due to insulin resistance or lipid imbalance or mitochondrial stress, repair processes slow down because cells simply don't have the resources to heal efficiently. And finally, immune exhaustion. After long periods of illness or treatment, the immune system can become overworked, not weak, but tired. So when this happens, surveillance and regulation suffer, making it harder for the body to maintain long-term stability. Now, as a pharmacist, I want to be very clear and responsible here. When we talk about PPAR pathways, we're not talking about forcing the body to heal or overstimulating the immune system. They are traffic controllers. They help cells decide whether to use or store energy, or improve metabolic signaling and energy balance, support immune regulation rather than immune overdrive. So this is why PPAR pathways are being studied and discussed in medically aligned conversations about long-term stability, not quick fixes. And as we close this first month of the new year, I want you to live with this mindset. Our goal is not to live in fear of recurrence, but instead, our goal is to live in alignment with repair because consistency beats intensity. So we look forward to continuing this journey with you, one slow but surely step at a time. And to guide us through this discussion, we are honored to be joined by two individuals who combine science, experience, and compassion in patient care. First, we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPAR's expert from Singapore, Mr. Shyan Lim. Joining him is Dr. Jansen a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening po!
Hello, good evening.
Good evening, Jan. Good evening, Jan. Good evening, Doc.
Hello, good evening.
That was a very useful and simple to understand presentation, Jan. Thank you very much.
Thank you
I hope
po.
everyone was blessed by it and that you learned something. That is Doc Johnson's line. That you learned something today. Okay,
Okay, let's start
let's
with the
go into our
questions.
Q&A.
First question coming from Facebook, Mr. Ruel. His question is, can PPARs be used while having the chemo at the same time? Or chemo might destroy the effect of PPARs?
Okay. So for this one, yes, you can. No, you can. But you cannot be taking the PPARs while you're infusing the chemo. Okay? So the reason why this is so is because chemotherapy is innately an oxidative therapy. So it kills cancer cells by way of oxidative stress. Okay? And of course, what we know, no, the basics, no, oxidative stress is counteracted by your antioxidants. Simply Nature PPARs is made from microalgae, and microalgae are very rich in antioxidants. So essentially, if you take any antioxidant for that matter, no, not just Simply Nature PPARs, but then you go for the chemotherapy will wipe out the antioxidants, no, and it can impact the efficacy of the chemotherapy. Okay, so the way I do this is I take a look at the half-life of the chemotherapy, then I
Mm.
compute more or less how much time would it take for the body to eliminate the chemotherapy. Then that's the time that I ask the patient to, okay, you can now take the PPARs. Okay, so that's how we do it.
So as a simple rule of thumb, I mean, have an appointment with Dr. Jansen to know specifically how long before and after your treatment you can take the PPARs. It's usually calculated in hours, like 12 hours or maybe 24. So I think the simple rule of thumb is you take it maybe about 12 hours or at the end of the day, especially if you had your infusion in the morning. Okay. So again, there is because Simply Nature PPARs is totally natural. If for example you have a very adverse reaction to the chemotherapy, right, or you're feeling very terrible from it, then you can take it to help your body recover quickly. Of course, that might reduce some effect of your chemotherapy, but sometimes patients are having such a difficult time dealing with it. This is better than not being able to continue with your chemo sessions, right? Okay. Jen?
Okay, a related question. I have a patient yesterday who is
Mm,
taking tuberculosis medicines, but that is
mm,
taken before breakfast.
mm.
So how can they incorporate PPARs also if it should be taken before meals?
No, I think tuberculosis medicine is usually antibiotics, right? So
Yes.
it shouldn't
Antibiotic.
have any, yeah, it shouldn't have any complications with it, mechanism-wise.
The PPARs can bind the antibiotics.
Oh,
So
oh,
what you do is you
mm,
ask the patient to take the PPARs in the evening or at least
okay.
2 hours after eating.
2 hours after. Okay. Okay. A few hours after. I think maybe 4 hours would be safe. Mm.
Okay, just to be double safe. Okay, next question coming from Miss Gladys. I am on menopausal stage and I'm having a hard time. Is there anything that can ease my agony? Starting last year, 2025, I've been feeling different and my blood pressure has been fluctuating up and down. So my maintenance was changed from losartan to telmisartan. And I also have body aches, mood swings. There's pain in my body I don't understand. I am lazy, but I feel tired. Now I also cannot sleep well.
Oh, Doc, I think this is a very good question because many of my friends, and of course my wife, is reaching that age. Please enlighten us, including the husbands that are listening. What actually happens and what can we do to help our wives? Yeah.
Yeah, that's perimenopausal symptoms. So you just eat more soy foods
Oh,
because
really?
soy foods are rich in phytoestrogens. But
Okay.
of course, no, if soy foods doesn't work, then might as well go to see a doctor, integrative medicine doctor who's well versed in bioidentical hormone replacement therapy. So the doctor can help with the hormonal imbalances. So that's what you do.
So you
Unfortunately,
mentioned
I'm not one. So
okay. So you mentioned integrative doctors for hormone. Are these like natural or are they like the hormone therapy that conventional doctors use?
different. The
Oh, it's
ones
different.
that the conventional doctors, the OBGYNs use pills,
Okay.
oral contraceptive pills because these are
Yes.
estrogen.
Mm.
The ones that integrative medicine doctors use is different. It's bioidentical hormones.
Okay. Oh, wow. All right. So,
Yeah.
do you know of any integrative doctors in the
Dr.
metro?
Ruby. Dr.
Oh,
Ruby,
Dr.
my friend.
Ruby.
Yeah, she's
Okay.
one. She is the one that is usually our speaker in conferences.
All right.
When it comes to bioidentical hormone replacement therapy. So yeah, Dr. Ruby magpantay.
Wow. Okay.
Medic,
So when you go to Dr. Ruby, remember to tell it's Shan and Dr. Jansen, Simply Nature, that sent you over there. And since Dr. Ruby is a lady herself, yeah, I think this is I mean, she can definitely empathize with what you're going through.
Okay, next question. From YouTube. Okay. What is the treatment for ER and PR positive but HER2 negative?
hormone therapy. Hormone therapy, that's anastrozole, tamoxifen, fulvestrant, what else? Exemestane. Those are the ones. Palbociclib as well. That's a targeted therapy for this kind of breast cancer. Of course, if the size permits, surgery would be one of the treatments that would give you the best increase in survival rates. Then depending on the stage, chemotherapy and radiation therapy. Those are the mainstays. On our side, on our end, on the integrative oncology's side, I don't really look at whether or not the cancer is hormone receptor positive or not, no. As long as it is a cancer, I have my protocols in place to target the cancers, to target all aspects of the cancer. So target it metabolically, boost your immunity, reduce treatment resistance, and then use some substances, medications to kill the cancer cells, no? And of course the cancer stem cells as well. So those are some of the treatments that you can go for. And again, which treatment you have to go for would entirely depend on your history. So you have to talk to a doctor.
Now, Jensen, I just wanted to ask, is there a distinctive difference between how an a conventional oncologist versus an integrative oncologist, how your strategy and approach towards treating cancer, is it the same? I mean, for example, for naturopathic docters who many of them may not even be medical doctors, but they just study natural medicine, naturopathy, naturopathy, is usually to strengthen the body and then let the body kill the cancer. For an integrative oncologist, how does your strategy differ from the conventional and the naturopathic? Yeah.
Yeah, it differs in the sense that for the conventional oncologies, they usually focus on eradicating the cancer per se.
Okay.
Of course,
They target the cancer. All right.
yeah, attack the cancer. But of course, they look at you, no, holistically. But they also consider other aspects of your health, of course, no, such as your immune system, these things. But um, their procedures, their treatments are more geared towards reducing the tumor burden. Okay, so the amount of
Okay.
tumors that in your body. So that's the main goal. In the integrative oncology's world, no, we are more focused on the metabolic health, the immunity. We also focus on the cancer itself, but our methods or our tools work slower compared to the conventional
Oncology.
oncology's methods. So with these limitations, we really have to get a mix of both so that we get a better outcome for the patient, no. So it seldomly you see success if it's just one school of treatment. Yeah, so you see, sometimes, for the conventional oncologist side, no, you see recurrence. Sometimes the patient wonders why is it so, everything has been done and then the cancer comes back. Yeah, so on our side, same thing. I also do see some patients jumping from one doctor to another, and the cancer continues to grow. Yeah, so and yeah, so those are some limitations. So
Okay.
you have to marry both worlds, so to speak. So
You
yeah, so
know,
that's the difference.
To all the cancer patients who are thinking what strategy to use, as Doc Jansen says, the conventional doctor doesn't focus much on they pay attention, but they are not trained, and that's not their focus on your holistic health. That means the real health of your whole body, right? When they are concerned about your organs or your red blood cell count, is correct me if I'm wrong, Dr. Johnson, but it is also primarily to make sure that they can continue with their protocols, right? That your body can handle the chemotherapy load, right? So they are more focused on, like what Dr. Johnson said, on the cancer cells and the cancer cell count. On the naturopathic side, the challenge, for all those who are considering naturopathy is very seldom will your naturopathic doctor, I wouldn't say never, but very seldom will you find a naturopathic doctor who will know how to coordinate and complement their protocols together with if you're going through chemotherapy, right? So that means if you're going through chemotherapy, it's very hard to find a naturopathic doctor that will be able to work with the chemotherapy or radiation therapy or the immunotherapy that you will go for. So very often that's why many times you talk to people, it's either conventional or natural, because the two sides, especially the natural side, doesn't know what the conventional doctors are doing. And then the conventional doctors don't put a lot of focus on the naturopathic and maybe sometimes cautious with some of the approaches naturopathic do, especially a lot of naturopathic doctors actually do use like direct selling company products. Again, there are many direct selling company, multi-level marketing products that are very good and effective, but there are like thousands of network marketing and direct selling companies, which is why there are always some bad actors. I mean, some companies that are not so good, but again, there are good products from these companies that do help cancer patients. So I'm just saying that, in general. Now, I think what Dr. Johnson shared about him being an integrative oncologist is wonderful, is that he is familiar with the naturopathic, with the lifestyle, especially the science behind it and the approach. And he's also familiar with the conventional. So he's able to keep your options open. So for a patient who wants to fight cancer, I think you want to keep your options open. So it's really strange. Everybody is an individual. Some people react better with this protocol, others with that. So keeping your options open is one of the, I guess, one of the very positive things that you can do in your approach. So yeah, I'm very thankful for Dr. Johnson's love for integrative oncologists. He wanted to be an oncologist. In a way, I'm very thankful he did not become an oncologist, because there are already many oncologists in Philippines, but there are very few integrative oncologists like him who is able to marry and keep your options open and to support you through conventional when the natural is not working and you want to go for conventional. And Dr. Johnson can support you through that as well, and can be your primary primary consultant when it comes to natural as well. So it's really wonderful. So thank you, Dr. Johnson, for sharing with us the difference. Yeah. Jen?
Next question is very timely. It's coming from Miss Ali. Your question is, just in case, can PPARs help with Nipah virus?
What? Oh, virus. Okay. This one, very simple here, right? PPAR strengthens your body's immune system. Now, this is actually research proven. It helps your body. It strengthens your immune system by increasing your dendritic cell activity. So the function of a dendritic cells is basically to identify viruses, bacteria, and anything that is not supposed to be in your body, right? So number one, that is already helpful. Number two, it increases your macrophage cells, your NK cells, your T cells activity, right? So that is your general immune system. So whether it will be very effective specifically to this virus that has just started going around, we can't answer. But will it improve the overall, your body's overall immune system, giving you a better, the word is better, better shot at protecting yourself from the virus? Then I think the answer is a clear yes.
Thank you. That's very helpful. Okay, next question. From Miss
Oh,
Heidi.
hold on. COVID. I just share with you COVID. We have many doctors who use our products for COVID, right? So like Dr. Jaime, which Dr. Jansen knows also, he really used it to treat very elderly patients who came down with COVID. My direct interaction is actually with my B2B, Emerson's good friend from Bataan. He's actually working as a nurse in the hospital, and he was of course on duty during that period. So Emerson actually asked me to sponsor him because he is a healthcare worker during that incredibly difficult, 1 year that everybody was locked down. And these healthcare providers like Dr. Jansen so bravely continued to treat patients, right? And what his friend shared with us directly was that his colleagues were coming down with COVID, flus, fevers as well. Because even if you don't get COVID, when you're overworked, your immune system gets worn out, and you do succumb to other general illnesses as well. So he mentioned that he was the last. He did get COVID at the end, but he was the last one to get. Then again, these are the frontliners always meeting COVID patients face on, right? And he did also say that his recovery from the COVID and the symptoms were very mild. So I believe, he of course took his vaccination as well. So I believe it's the combination, the PPAR tablets, his vaccination, and his care and knowing how to take care of himself helped him. So if you're worried about the virus, then I would say just the Simply Nature PPAR tablets will be a good start. And that should be sufficient unless you have other health concerns as well. Yeah.
Thank you, Sir Sean. For the next question from Miss Heidi. Okay, I hope you can advise on how to get the staging without biopsy or operation.
Oh, is that possible, Doc?
Yes, you can.
Wow, you can.
Do it through
Okay.
imaging. We do it through imaging.
All right, we do it through imaging. Okay.
Mm.
So that's your answer, short and sharp.
Okay, next question from our website, Miss Jenny Lim. I have nodules in my vocal cords. What is best for me po?
Oh.
We have to find out what the nodules are first. So go you see your ENT doctor. Get the diagnosis.
And for this particular viewer, please take a look at Nesta's YouTube story. All right. So maybe one of the CSOs can send her the direct link. She can reference that. Yeah.
All right. Okay. More questions from our website, Miss Henedino. Is tablet form of PPARs already good for prostate enlargement?
I think
Can be.
can be. All right.
Can be.
Now, is it specific for it? Not specific for it, but it can be.
Yeah, but again, the PPARs is not the PPARs will not make your prostate small. Okay? It's not the mechanism of action, and it's not the one that PPARs targets. It's the metabolic health. That's the one that PPARs fixes, so your prostate doesn't grow more, no, because prostate tends to enlarge if there's insulin resistance.
So when we address the root problem, which is your insulin resistance, and that the PPAR's gamma is where PPAR gamma actually works on, which is how people with high blood sugar, their blood sugar becomes normalized. It's through that action. So we get rid of the root cause. Hopefully your prostate will also shrink. But then again, your prostate enlargement could be many reasons why it enlarged. But if it happens to be what Dr. Jansen example that Dr. Jansen gave, then you will see good results.
Okay, next question. I think it hasn't been asked before. It's coming
Oh wow,
from
great.
Leo. Okay.
New question.
It's kind of hard. Okay, for chronic neurological genetic problem, SCA3, what would be a simple regimen to start with?
Wow.
SCA3.
I'm not the expert to ask.
Yeah. So
Yeah.
on this program, if we don't know, we'll tell you we don't know. Okay. So as no, continue another question.
SCA.
I'll do a little. What's it called? SCA.
Yes, SCA, the number 3.
Okay, I'll take a look.
Okay po.
Yeah.
Okay, moving on to the next question from Facebook, Miss Anne Mary. Is PPARs can be taken by stroke and bedridden patient with CKD?
Oh yeah.
Yeah, it's okay.
Yeah.
Okay,
Yeah.
should be okay. But I would give the powder instead of the other ones.
Yep.
Okay. Next question from YouTube from Angelita Capili. Can PPARs affect COPD?
Yeah, it can because COPD is an inflammatory disease, no? So PPARs having good antioxidant effects, then it can help with patients who have COPD.
Mm. Okay. Well, I guess this is our last question for tonight. From Veronica Marcelana. Okay, Doc, what if the lump is hard but it's moving? What is this? And what is a good solution to make it go away?
Okay, this is where it gets tricky. Because you have a movable lump, which tells me that it's benign, but yet it's hard, which is a character of malignancy. What I would do if a patient presents to me with with such a character of a mass, no, I would look at the size. Is it regular? Is it irregular? Another thing that I will look into is the pain. Is it painful or not? No. Now, after getting those characteristics, I would further request for imaging depending on where the lump was found. Usually, an ultrasound would suffice already. However, if the suspicion of it being malignant is high, I would just request for a CT scan instead of just an ultrasound. So yeah, so it really depends, no. But the next step would be to do an imaging study. So that would be either an ultrasound or a CT scan. So that's the next step. Then once we get more information as to the characteristics of the mass, no, um, if the result still comes out, I mean, if the result still comes out, a big question mark, whether or not it's benign or malignant is still a question. Then a biopsy has to be performed, or well, it's movable. If the size is manageable, if it's small enough, then probably an excision biopsy can be performed, no? So that's that's the next few steps doon that I'm thinking that might happen.
All right. Jen, I want to go back to the SCA3
Okay.
question. So this comes out from just to be clear, this comes out from a search that I'm doing now. So it's not that I'm speaking from experience. All right. So spinocerebellar ataxia type 3. What's interesting is that the search is actually showing that PPAR agonist alpha and gamma is now actively being researched as a potential treatment. Right? So the pharmaceutical companies are actually looking at this mechanism as a potential treatment. And to be clear, the treatment is not a cure. It's aiming to slow down the progress of this disease, right? So the mechanism of your disease is that a specific segment of your DNA repeats too many times, leading to production of an abnormal toxic protein called antaxin 3, right? So the purpose of the PPAR agonist is in neurology, right? Right now in neurology community, PPARs and the type 2 diabetes drugs like pioglitazone is generally looked at for its neuroprotective properties. So this is where they are researching it. In SCA3, according to the research here, it disrupts mitochondrial functions and increases oxidative stress. So this is the reason why, number one, our PPARs helps patients who are undergoing chemotherapy. We actually protect the mitochondrial function of the cells. So here, the research says that activating PPAR receptors, especially gamma, stimulates production of the master regulator that helps create new mitochondria and strengthens the cell defense against toxic proteins. So, okay, so down here, it says this. So maybe you can do some research on your own. So if you want to try, then I guess here is looking at the higher, is really looking at PPAR agonist activity. If you want to try and see if there's a litmus test whether it works, then there are two strategies that you can go for. Number one, I wouldn't suggest the tablets if you want to know whether it works, right? Because that might take too long. If you want to look for some improvements, right? So I would either suggest the liquid, which is the strongest, and after 10 days, would you feel any better in your numbness or whatever? This one you have to check your own body to know. And the other one is powder extract, right? Which will last longer than 10 days. You probably take 2 scoops twice a day and see if it helps your condition, if you can feel any difference, right? And if you're, again, we're not very familiar with the disease, so I don't know how you track the progression of how your disease is getting worse or not. But the good news is that, yeah, PPAR agonist is actually being researched by pharmaceutical companies as a potential treatment. Okay, so what's the difference between what the drug companies will do and what ours is, right? So drug companies will actually find a specific ligand or a compound that will trigger PPARs, right? So actually what happens is you find an agonist. The word is a catalyst, right? So you want to trigger PPARs. So they will find a synthetic one. They will research a synthetic one which they can patent. And because if they can't patent, they cannot recoup their investments in research, which will cost millions, right? Next, so that is pharmaceutical PPAR-based drugs. Now, what's the difference between that and ours? Ours is natural. So our natural PPARs has not shown to have any contraindications. And because it's natural, the body, and we have been around as a food for 30, 40 years. So we know that the body breaks down our microalgae and hence the extracts naturally, and there's no contraindications. So this is very different from the pharmaceutical, but the mechanism is the same. Now, the advantage of drugs is that they're very targeted, so dosaging is very clear. So if your doctor will look at your condition, and if there was a PPAR-based drugs, they will know exactly how much to give you, right? The research will be very clear on the dosaging. However, ours is a natural extract, it's a natural supplement, food-based. We cannot give you that concrete answer, right? Because we don't research into the dosaging the same way as the drugs. And the reason why we don't is because we don't have the harmful effects of the drugs as well. So there's advantage of drugs, but there's also advantage of our Simply Nature PPARs, is that it's something safe that you can try. I really would not know if this would be helpful for you or not, but the research is very promising. So if this is something important you want to try, go ahead. Good news is your metabolic syndromes, your blood cholesterol, blood sugar, all this will improve, right? And your general inflammation. So if you suffer from joint inflammation, pain, all that, that's going to help. So there is always that positive effect. But thank you for this question. This is the first time I see this. This has prompted me to explore speaking to neurologists, since this is a disease that they don't really have, correct? They're looking for new treatment targets, all right? Okay, thank you.
It really sounds promising. Going back to second to the last question. Okay, KJ David from Facebook. Hi, Doc. There's a small lymph node in my nephew in his private part, but he's still 3 years old. What action can we do or test that we can do?
Ultrasound. Yeah, check what's the consistency of that nodule. Yeah, ultrasound. That's what you do.
Okay,
Yeah.
that's it. Okay, before we do the last question, let me just greet our viewers, Miss Naomi Veras from Marikina and Marmin Andrada. Okay. This one coming from Miss Eileen. If I start my chemo on the 9th of February, can I still have PPARs before chemo? Will it help me from becoming bald?
Okay, here's the timing, no. So this is for all patients, no, undergoing chemo who's taking some sort of antioxidant, not just PPARs. You stop taking the antioxidants at least 24 hours prior to the infusion. So say for example, you're taking the chemotherapy on the 9th, then you don't take any antioxidants already on the 8th of February. Now, the next question, will it help you? Will it help fight baldness from the chemo? I don't know. I don't know. But for my experience, no. If the chemotherapy side effect is going bald, you will really go bald. No matter how much antioxidants you take. But the good thing about it is the baldness is reversible. So your hair grows back after the chemo ends.
So I will also encourage you. Last time, many people asked me if they want to take PPAR so that they don't go bald and so that they don't shave their hair. So I will encourage you, because later, after interacting with especially pediatric cancer patients, shaving your hair is so that you can't tell whether you're going bald or not. Right? Yeah, because it's very traumatic. Imagine a child to see their hair drop, right? So they shave their head so that the child won't know. And you don't, so it's one less psychological stress. You don't need to worry because it looks the same whether your hair is dropping or not dropping, right? So I would say that will apply to an adult as well. I've noticed, I met with many cancer patients. What they did is they became fashionistas in bandanas. They started to use different style of bandanas, very beautiful bandanas also, right? So look at it as something fun that you can do, all right? And to take away the stress of, am I losing my hair or not? So just shave it, go into bandana fashion for a few months, and then it will grow back after your treatment, after you get back your health. Wow, I'm just looking to thank you for the SC the question, right? Because I actually checked again what treatments are currently available. So there are only three. One is gene editing, so using CRISPR, right? Which is three avenues. There really isn't any therapy apart from dealing with the symptoms, but not the actual disease itself, right? The actual disease itself, they are looking at gene silencers so that your cells don't produce the toxic protein. PPAR agonists for improving mitochondrial health and reducing inflammation, which is exactly what we do for cancer patients using chemotherapy drugs. And the last one is actually gene editing. So thank you. This is very interesting. So I really learned something new tonight. Yeah.
Okay, well, it looks like we've covered all our questions. So, as we wrap up this evening,
I
we'd
think
love to hear
it's
your
to
final
invite
thoughts for
Doc
our
Jansen for
viewers.
yeah, parting words.
Yeah, so thank you everyone, no, for watching again this week's webinar. And
Yeah.
all of the questions are really good, really wonderful. Every time, no, every single week
Yeah.
since 3 years, 4 years ago.
5 years already,
Five
Doc.
years already, 5 years, yeah.
Wow. Grabe.
Always new questions, no? So keep them coming. And with you asking all these questions, you support the program. And by asking questions, other viewers also learn. Okay? So thank you so much, no? Thank you so much for having me. And I'll give the floor to Sir Shen. Good night, everyone. Good night.
Good night.
Oh.
Thank you everyone for joining our program, and thank you for the very interesting question today. I really learned something new. In fact, I've been talking to some to some patients who are undergoing neurological disorders, specifically actually Parkinson's, right? So it's really interesting that tonight the question has got to do with neurology. And, it's also very encouraging as I researched that question live just now, that that to find out that now in 2026, right, that neurologists actually look at PPARs, all right, as neurologically protective, right? So that's interesting. I know that came to my attention with Dr. Hambra many years ago, but that's just one doctor. So it's very interesting today that from your question, I learned that there is significant interest in the neurology community. That means all your neurologists to look at PPARs and for its neuroprotective properties. So I've experiences with stroke patients. Their neuroplasticity improved. Of course, for each one of them, they were very aggressive in getting back their mobility, and they did get it back. So yeah, thank you for your questions. We look forward to more questions, and we really enjoy this year. Is going to be a great year for us to all learn together, and also to every one of you who is fighting cancer or other health issues, that this will be a good year for you and that you will see victory in 2026. So wishing everybody all the best. I'll hand the time back to Jen.
Thank you so much to our experts, Mr. Shyan Lim and Dr. Jansen Kalalan, for sharing their knowledge and insights. And for those of you who wish to have a consult with Dr. Jansen Kalalan, you can schedule an appointment using the link in the description box and comment section below. Our caring healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. If you have any follow-up questions, don't worry. We will answer each of them next webinar or via direct message. And we hope to see you again next week for another empowering session. Same day, same time, every Thursday night at 7:30 p.m. And as part of our commitment, we're extending our free shipping promo nationwide for PPAR's liquid vial and powder jar only. Exclusive via website orders only. So that's simplynature.asia. Also, we're proud to introduce a new beginning for sensitive skin. We're offering a buy two, take one 80 Pro Psoriasis and Eczema Probiotic Skin Serum. It contains no steroids but natural probiotic support designed to help reduce inflammation from the root cause and support healthier skin microbiome. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we're always with you from start to healing.